I'm Margaret Preston, president of Power Over Parkinson's, and today, in conjunction with our Pop Profile series, we have Dr. Sule Tinaz. She is the Associate Professor of Neurology at Yale School of Medicine, the Movement Disorders Division, the Clinical Neuroscience Imaging Center. Dr. Tinaz, thank you so much for being with us today.
Thank you very much for having me, Margaret.
It's a pleasure having you. We're so thrilled to have a chance to speak with you today. As many of our listeners know, we are a big proponent of physical activity, exercise, preferably high-intensity exercise, and really advocating the use of exercise to navigate the disease. So having you with us as a researcher studying this aspect of how to mitigate the symptoms of the disease is really fitting and in alignment with our mission. So it's a pleasure to speak with you. And I'd love to start with kind of a big question. Share with our listeners a synopsis of your background and what motivates you to be in this sometimes difficult research space.
Yes, thank you. So I'm a movement disorders neurologist. I care for people with Parkinson's disease and other movement disorders in my clinics. And I'm also a researcher with a special interest in Parkinson's disease. I use brain imaging technologies to investigate the brain basis of disease progression and of symptoms of Parkinson's disease. Right. Another important component of my research is to develop non-pharmacological and non-invasive therapies to slow down disease progression and to help people cope with their symptoms, to alleviate their symptoms. And some of the therapies I've been working on are obviously exercise and cognitive training. And I use brain imaging tools to examine the brain effects of these therapies. Well, what drives me in my research? Good question. I think we all want to have a cure for this disease, and there's fortunately a lot of exciting research going on to find treatments to slow down or even reverse the disease progression. My research focus is to develop, as I said, personalized therapies that people can use to cope with their symptoms, have control over their disease course, and improve their resilience and well-being. Sure. And what motivates my research is rooted in the concepts of self-efficacy and agency. And what do I mean by that? Self-efficacy is the belief that we are not passive receivers of whatever life throws our way, but we're active agents with the capacity to make choices, influence our thoughts and behaviors, and handle challenges in our lives. And my research taps into that capacity and tries to strengthen it further. A strong sense of agency and self-efficacy helps us to do the right things for our own health and well-being, and it has been shown to correlate with better health outcomes in chronic diseases. So that's what I do.
Yeah, that's very well said. And I think the beauty of exercise is that it provides that self-agency, that it gives you something tangible to take control of as you hope to slow the progression of the disease.
Absolutely.
Great. Well, let's move on to the science behind the impact exercise has on Parkinson's. So scientifically, how does exercise positively impact the symptoms of PD, and how does it physiologically reduce the symptoms?
Right. So as you and your listeners know, major motor symptoms of Parkinson's disease are muscle rigidity, slowness, weakness, gait and balance problems, and different types of exercise have different impact on these symptoms. For example, aerobic exercise improves overall cardiorespiratory fitness and energizes us, right? So resistance training improves muscle strength. Exercises focusing on balance, for example, yoga, tai chi, they improve balance, posture, postural stability, and very importantly, they prevent falls. Stretching improves the muscle stiffness that I mentioned. Explosive exercises like doing jumps and squats or boxing, so they're very good to improve power, strength, and speed. Okay. And high complexity exercises, for example, dancing, that improves coordination and motor skills. And lastly, I also want to emphasize that exercise is very good for our bone health too. So it prevents fractures.
Absolutely. You touched on, you segued into my next question beautifully, and you touched on some of it, but what symptoms of PD? You talked about coordination and balance. Is exercise known to improve?
Right. So those are the motor symptoms that I just mentioned, but the benefits of exercise are not limited to those. Right. Obviously, it improves the so-called non-motor symptoms of PD as well. So sleep quality, mood, attention and processing speed, and overall quality of life. And more importantly, I know you and your listeners would want to know about this more, it slows down the clinical progression of disease.
Yes, absolutely. And moving on to disease progression, how does the use of exercise slow the progression of the disease?
Yes, wonderful. That's very important. So it doesn't only provide symptomatic relief or improvement, it slows down the clinical progression. But before I talk about that, I also want to mention that exercise not only slows down the disease progression, but it also has a preventive potential. Large studies with thousands of people in the general population who were followed over many years demonstrated that those who engaged in higher levels of moderate to vigorous physical activity in middle or later life had a lower risk of developing Parkinson's disease. So this is very recent research. On top of that, so regarding the physiological effects of exercise at the brain level, we know from animal models of Parkinson's disease that exercise reduces inflammation in the brain, increases vascularization, increases the levels of nerve growth factors. These are special nutrients for brain cells. It also improves mitochondrial function. Mitochondria are the energy factories of the cells. And taken together, all of these changes result in protection of the brain cells, and specifically of dopamine-producing brain cells that are affected and they're vulnerable in Parkinson's disease.
Okay. And so really having that neuroprotective quality to preserve what is left of the dopamine-producing cells. Is that fair?
Absolutely.
Okay.
And in our recent study, I don't know if you want me to mention that or...
Absolutely.
The recently published the proof of concept study was a small study, pilot study. We demonstrated the potential neuroprotective effects of high intensity exercise. So we used two different imaging modalities and found an increased dopamine signal in the brain of people with Parkinson's after 6 months of high intensity interval training. So that's encouraging. That is suggestive of a neuroprotective potential.
Okay. Well, in your research, as we've talked about, and as you just noted, you really examined the use of intense exercise, particularly those with mild or early PD. So can you share with our listeners how we define intense? I'm sure it's subjective in some ways for our listeners, but how did you define intense for the study?
Right. That's important. There are various definitions of high intensity. We use the definition of about 80% of the age-appropriate maximum heart rate. And the maximum heart rate is calculated with a rather crude formula. So 220 minus your chronological age approximately gives you your age-appropriate maximum heart rate. So for example, according to that, if you're a 70-year-old person, your high-intensity heart rate target would be about 120 beats per minute. If you're a 60-year-old person, it will be 128, etc. So, well, of course, one should not expect to get to that high intensity level all at once. It should be done gradually and carefully. And I also would like to emphasize that not everyone is able to reach their target rate, target heart rate. And there are several reasons for that. For example, a lot of people use blood pressure medications that can lower the heart rate. So that's one thing. And Parkinson's disease itself affects the adrenergic nerve endings in the heart muscle. So if the heart muscle, because of that, the heart muscle may not respond to the increased demands during exercise by beating faster. So your heart rate may not increase just due to the pathophysiology of Parkinson's. So in those cases, we recommend not to get too obsessed with that number. There are also subjective ratings of effort that can be used. For example, if you're putting really good effort into your exercise, you're feeling short of breath to the point, you know, you can barely speak a sentence, a full sentence. That is already considered vigorous exercise, even if your heart rate is not reaching the target.
That's excellently explained, because I think it's easy probably to get fixated on that number that you have to achieve, but there's some other avenues to get there if it's near impossible for whatever reasons, Parkinson's, etc. So thank you for sharing that. Is the use of exercise and its benefits limited only to the newly diagnosed? In other words, can those who have had the disease 5, 10, 15 years still enjoy the benefits of exercise on symptoms of PD?
Absolutely. So, well, the earlier one starts exercising, the better, of course, but the benefits of exercise are experienced at any stage of the disease. That's for sure. It's never too late to start exercising
Absolutely.
to obtain those long-term benefits.
Yes.
And, if there are contraindications to high intensity, or if people find it difficult to do the high intensity, even moderate intensity exercise at higher volumes, meaning more repetitions, longer periods, can also be equally effective. There's one thing that I'd like to highlight, though. At later disease stages, we should be mindful and aware of potential risks during exercise, like fall risk, or if there are any cognitive problems, it can be difficult for people to follow instructions. So those are some of the limitations people should be aware of.
Sure, but it's nice to know that there's combinations in which that you can utilize. If you can't achieve that heart rate, you can go a little bit longer, utilize more repetitions, etc. You can kind of fiddle with the metrics a little bit.
Absolutely.
Very good. Well, similarly, what would you tell people with PD who are early in the disease and may not be experiencing pronounced symptoms? So should they, and you almost answered this question in the prior question, but should they begin an exercise routine today, even if they aren't very symptomatic? You can kind of put it off, maybe compartmentalize it a little bit, but is it ever too early to kind of intervene?
Yeah, this is a very important question, and my answer is a resounding yes.
Yes.
Just start immediately.
Absolutely.
And there's, again, evidence from literature. There was a recent study. They included 237 people with early Parkinson's disease, and they followed these people for 5 years. And high physical activity levels were strongly associated with better functioning in activities of daily living, processing speed, postural stability, balance, and gait. So it's really extremely important to start exercising as early as possible. Doesn't matter how mild your symptoms are.
Yeah, and I suspect what we talked about previously, the earlier intervention helps you kind of slow the progression of the disease, if you will.
Absolutely.
Absolutely. Okay. Well, exercise is one critical component. We'll put your general neurology hat on now. It's one critical component in managing Parkinson's disease. But as a neurologist, what would you say are other components of managing the symptoms of PD, and what should comprise a PD care plan?
Very important question. Well, first of all, every individual is different. They have different needs, different values, and priorities. We need to acknowledge that. So one size does not fit all, and care plans should be personalized. So that's important. So in addition to an optimized medication regimen and exercise, we do recommend several lifestyle modifications. One of them is diet. We recommend the so-called MIND diet, MIND, which is primarily plant-based, a modification of Mediterranean diet. So consuming lots of vegetables, beans, fruits, nuts, lean proteins, olive oil, etc. Good hydration is extremely important, especially if you're exercising. So minimum of 8 cups of liquids per day. Managing constipation, it can be a very uncomfortable thing to live with. Again, dietary modifications, including more fiber, more water in your diet, and increasing physical activity and taking stool softeners, laxatives as needed. More in the mood and cognition realm, social isolation and loneliness. Those are big issues, unfortunately. So meaningful social engagement improves mood and mental well-being. We know that. Some mindfulness exercises also improve anxiety and depression. We recommend that. And intellectually stimulating activities, they really help people preserve their cognitive functioning. And I personally recommend active cognitive engagement. And what do I mean by that? For example, reading a book can be enjoyable and stimulating and pleasurable, but it's a relatively passive activity. But on the other hand, discussing a book in a book club engages many brain regions, and it's a very good mentally stimulating exercise. So that's what I mean by active cognitive engagement. So those are the main things I would recommend as a comprehensive care plan.
Very good. Okay. Well, how do you direct those, moving back to exercise, of course, how do you direct those who are new to exercise and unsure of where to go when starting an exercise regimen? So you probably have diagnosed many folks or treat many folks who might just be new to exercise or have never exercised, and now it becomes quite critical in their disease management. So how do you direct folks to kind of get started?
Right, right. So if a person has no exercise experience, or if they're reluctant to enroll in a program, I usually refer them first for physical therapy.
Okay.
So a rigorous physical therapy program is a very good start.
Mhm.
And at least here in Connecticut, we're lucky to have many wonderful rehab and exercise programs for Parkinson's disease. And the program that we used in the study is called Beat Parkinson's Today. So that is a Parkinson's specific program that offers high intensity interval training classes in person and online. But I realize that not every state has similar programs. I think I would recommend visiting the American Parkinson's Disease Association and Parkinson's Foundation websites. They list local resources for exercise, so people can find local information about programs, exercise programs there.
Absolutely.
That's a good start.
Yes, I agree. I think the Parkinson's Foundation and the APDA does a great job in highlighting kind of searching by zip code or city, what's available in your area. And I think that's a great starting spot, as is PT, of course.
Yes, of course.
As a follow-up to the previous question, do you recommend people utilize PD-specific exercise programs, or is it simply just staying active through a gym membership maybe they've had for many years? Is that as effective and kind of participating in other hobbies? Maybe they play tennis, pickleball, etc. So does it have to be PD specific?
Yes, so an active lifestyle, including walking, hiking, gardening, other active hobbies, that's very important. But I think it's not sufficient. I think we should also underline the difference between physical activity and exercise. So physical activity is defined as an active bodily movement. So walking in the park, walking your dog in the park, making your bed in the morning, carrying the laundry basket, all of this is physical activity. Whereas exercise is a special form of physical activity. So it's structured, repetitive, and purposive, with an objective to maintain or improve physical fitness. So that's the difference. By all means, more physical activity is always better, but it's not the same thing as exercise. So there are specific recommendations for Parkinson's disease and how exercise should be done. So again, Parkinson's Foundation, along with the American College of Sports Medicine, they created exercise guidelines for people with Parkinson's. I would recommend following those guidelines. They're available as simple, infographics in multiple languages for people with Parkinson's, and as fact sheets for exercise professionals. Briefly, the guidelines recommend a combination of aerobic exercise at least 3 days per week for at least 30 minutes per session at a moderate to vigorous intensity, and at least 2 to 3 days per week strength training, again for at least 30 minutes per session, and 2 to 3 days per week balance and agility training. So that this can be yoga, tai chi, boxing type exercises, and of course, stretching. Regarding the other part of your question, does it have to be PD specific, or does it have to be done in a gym with others, etc.? So I think working with an exercise professional who is knowledgeable about the exercise needs of people with Parkinson's, or joining a PD specific exercise program would be beneficial. And the reason for that is, the experts can assess potential safety issues. They can modify the exercise regimens as needed, determine what type and level of exercise you should start with and how you should progress. They can also monitor for safety during exercise to prevent injuries or any other adverse events. And more importantly, perhaps, the social aspect of PD-specific exercise programs really provides further motivation for people to continue and adhere to the regimen.
Absolutely. That's you touched on something that we found within our own program here in Richmond, that having a PD specific exercise program with others with the disease not only creates the motivation, but the friendships and kind of really touching on that mental health too, creating the community around you. So, you got that support through while you're exercising and through navigating the disease.
Right.
And what I hear you saying is physical activity is good. Keep doing your hobbies, you're moving
Yes.
your body, but deliberate exercise is certainly important throughout the week.
Yes.
Very
Yes.
good.
Well said.
Well, what do you think really has been the biggest barrier? There's still, I think, a lot of barriers to people understanding what is needed to navigate the disease, and certainly around exercise. So what do you think the biggest barrier has been to people with PD around the country, and really understanding how imperative exercise is in the comprehensive treatment of PD symptoms?
Right. I ask myself that very same question all the time.
Only we can
Um,
find the answer, right?
I know, right? So I can think of a few barriers off the top of my head. So one of them is definitely awareness and education, and that applies to us healthcare providers. I think we should better educate ourselves and our patients about the importance of exercise, definitely. And exercise should not be seen as a simple recommendation,
Yeah.
but it should be seen as an integral part of the treatment plan. I think
Yeah.
we really have to make that shift
Yes.
and a cultural shift.
Mhm.
So we should literally prescribe exercise as we
Yeah.
prescribe medicine. So that's one thing. Another barrier is, of course, access. So PD-specific, Parkinson-specific exercise programs are not widely accessible, unfortunately, in every state, or not everyone can afford those
Right.
programs.
Mhm.
And then there are significant health disparities in Parkinson's. So people of racial or ethnic minorities who come from lower socioeconomic status or have lower levels of education, they're less likely to have access to Parkinson's specialists or comprehensive care, including exercise.
Right.
So we really have to address those issues.
Mhm.
And another one is obviously personal factors.
Mhm.
So people have time constraints. I hear that in my clinics from my patients.
Mhm.
A lot of them are still working actively. They have work and family obligations. They find it difficult to
Mhm.
motivate themselves
Right.
to exercise and find the time.
Mhm.
But I think the silver lining, if I may say that, of the
Mhm.
COVID
Mhm.
pandemic was the shift to online classes, right?
Yeah.
They give a lot of flexibility. You can do it on a weekend, early in the morning before you go to work. So in terms of scheduling flexibility, I think that's been really a great additional opportunity for people joining virtual classes, online classes. And I think we also need to look at the big picture here. So why is exercise so important, I think? Well, Parkinson's affects over 1 million people in the US alone and over 6 million globally. And there was one study that predicted or calculated the projected cost of Parkinson's disease by 2037. So it's estimated to be $79 billion. So here we have an intervention that is known to alleviate the symptoms, most likely slows down the disease progression. So promoting exercise is a no-brainer, I think. It should be really a public health priority in Parkinson's. And, from an economic standpoint, I'm not an economist, who am I to say this, but it seems like it's a wise public health investment in the long run as well. So
Absolutely. And I think if we can touch on the national plan and the importance of that coming down the pike, I think kind of all of us collectively coming together and waving, the flag and saying there needs to be something done, because it will be a burden economically for our country and certainly other countries as well. So I almost see you all as neurologists prescribing medication, of course, the standard levodopa, carbidopa, but also prescribing exercise, right? I almost see it written on a piece of paper to really emphasize that it's just as important as taking medication. But
right, and maybe insurance plans can start covering for that
you're
too,
exactly right.
the way they cover for physical therapy. So why not paying for exercise as well?
Absolutely. And that just aids in the accessibility to exercise. So absolutely. Well, as we summarize, I'd love for you to share with our listeners where they can go to learn more about your research at Yale and how they could potentially get involved with research in their localities.
Right. I'm hoping to continue this research, and this time, I mean the exercise research, this time mainly focusing on the cognitive benefits, brain and cognitive benefits of exercise. So I'm working on a grant and depends on NIH funding. So stay tuned. But we have other exciting research going on at Yale. One of them, and I'm the study physician on that research as well, it's about the effects of ketamine in depression and Parkinson's disease. So that's a Michael J. Fox Foundation funded trial. So that's an exciting one if your listeners are interested. They can simply type Yale clinical trials as a search term, and it will take them to our clinical trials website, and they can find Parkinson's trials or studies going on. And the other good resources for local information is, again, the Michael J. Fox Foundation. They have listings of Parkinson's trials, and the official government webpage, NIH webpage, clinicaltrials.gov. So you can put the search term there, Parkinson's, and find out about all the studies locally across the nation or even internationally.
Yeah, I always like to be able to share that with folks because I think, like exercise, participating in research gives us a sense of control and having a hand in therapeutics and ultimately the cure. So I appreciate you sharing that.
Absolutely. And for us to be able to do these studies, we do need participants. Yeah, many clinical trials suffer from low recruitment rates. So we can only change that if we actively engage people.
Absolutely. Well, Dr. Tinaz, I can't thank you enough for sharing your time with Power Over Parkinson's and our Pop Profile series. It's been a delight to really exacerbate the emphasis of exercise and what it means on the symptoms and the disease progression. So you sharing your time is instrumental in continuing to educate our population. So thank you.
Thank you very much for having me.
Absolutely.
Thanks.